saw the mask display and just something in me clicked. I lost it.
I'm not playing anymore. This over. This all over. This over.
No, no. Do why? Why? You let everybody else do it. You let everybody else do it. Why I can't do it? Because I'm a blonde white woman? Wear a $40,000 Rolex? I don't have the right stuff.
That was the inevitable rock bottom before I was willing to get help.
Welcome back. We're here with Dr. Batra and Dr. Jackie. We've been talking to Melissa about her viral mental episode that happened in Target this past July. Let's bring in psychotherapist and New York Times best-selling author, Dr. Michael Dow. Welcome to the show, Mike.
Thanks for having me.
All right, you've heard what's been going on, and we need your help here to sort of sort through what's going on.
Yeah, so first I think we need to understand that this is trauma. So the compassionate mental health professional in me knows that Melissa is a woman who had decades of untreated trauma, right? So I saw hints of bipolar disorder. Psychosis is part of many different mental illnesses. I think in Melissa's case, it was probably bipolar disorder and that psychosis. But I also have to say that the human part of me, Melissa, there's still this part of you that feels very, frankly, unlikable at times, that there's this part of you that is still, there's an incongruence between what you are saying and the emotion with which you say it. So, you know, I really like a lot of your words and your apologies, but there is this part of you that still feels like it's not genuine. But I also, the therapist part of me also believes, and Melissa, let me ask you this as a question, that you grew up feeling that everything was not going to be okay. Your mother's disease, then her death, your father's death. It feels to me, you know, my sense is that you created this perfect image and a house, and even your very put together look, and even the way in which you speak, that was all an effort to maybe convince yourself that you were okay. Is that accurate?
I would say that is 100% accurate.
Have you cried? Have you cried? Have you become emotional?
Yeah.
Okay.
Yeah, I've cried a lot. But
And I ask that not to be mean, but we know that in successful treatment of trauma, if there's an incongruence between what you're talking about and a sort of poised demeanor that's saying, oh, well, this is fine. And I think that's what we're seeing in you today, right? It's this poised demeanor. But in successful treatment of trauma, there has to be a congruence between what you're saying, an apology, and the emotion, right? Which is, I think, what we're not seeing today, which I think sometimes comes off a little inauthentic at times.
It feels like you're justifying your behavior.
what I do for a living is help people, come across professionally and poised in everything they do, especially in the media. So of course, if I'm appearing on television, I'm going to come across professional and poised. That's just a fact of who I am and how I operate. Privately, in private treatment, it's a completely different story.
That really makes me happy to hear. Listen, I think if any of us watching you today feel that there's still an element of being inauthentic or not truly emotionally apologetic, I also can see that there is a hurt little girl who had a lot of trauma, a lot of anxiety, probably some genetic loading. And we also know from research that people who are struggling tend to believe in conspiracy theories. So that is what helps me to have compassion for you, that you were somebody who had this perfect storm of all these things going on. And we also know from research that when times get very uncertain, and certainly the pandemic, for all of us, there was so much uncertainty that is when people tend to believe in conspiracy theories more.